Health departments in more than 20 states are screening dozens of people whose symptoms are consistent with the virus, including 3 in Virginia. Globally, at least 80 people have now died from the respiratory illness. At the epicenter, Chinese authorities have shut down 17 cities near Wuhan, affecting more than 50 million people. The U.S. is evacuating its consulate and some Americans from that area. Health officials are monitoring arrivals from the area at 5 U.S. airports. Pat?
Thank you. The question is, are they overreacting? It looks like this is a flu-like virus. It does kill people, but is it? I mean, the whole Chinese economy is now in turmoil, and they're restricting millions of people in their movements on this holiday. This is the big deal for China, this New Year's. Well, joining me now is CBN Health reporter Laurie Johnson. And Laurie, how concerned do you think Americans should be over this coronavirus?
Well, Pat, the CDC said the risk to Americans is low, although they do point out that there will likely be more cases diagnosed in America. Health officials are quick to point out, Pat, that Americans should be far more concerned with a different virus that is spreading throughout the United States and is deadly, and that is the influenza virus, the flu. So far this season, Pat, 56 children have died from the flu in the U.S., 8,200 adults, and it isn't even February yet. February is often the peak of the flu season in the United States.
Well, why do you think people have gotten so panicked about this particular coronavirus?
Well, because it's new primarily, and they don't know what it's going to do. Is it going to mutate? They want to get a handle on it, and they also want to develop a vaccine for it. The World Health Organization met for 2 days last week, and we're trying to decide whether to declare it a global health threat, and they decided no, that it doesn't really rise to that yet. It is definitely an emergency in China, but not elsewhere. The director of the World Health Organization is going to China today to get more information. And of course, this could change at any time, and we'll keep everybody updated.
Well, now, Larry, before you leave, if somebody gets it, 2 now in Virginia, where we happen to be living, if somebody gets it, what do you do to treat them? Well,
the people in Virginia are being tested for it. And what happens is it's an upper respiratory virus. And so the symptoms are very much like the flu. And people who are at risk can have their samples sent to the CDC. And with 24 hours, the results can be confirmed. And many of the people who have been tested by the CDC do not have the coronavirus. So that's good. Only 5 confirmed cases in the United States so far.
That's, I think, encouraging, but it's amazing how we're panicked on this particular thing. And she says influenza is much worse and a lot more people dying from it. But anyhow, the quote, the common cold and now flu.